Hello, and thank you for coming back. This is Dr. Burton Schuler of Panama City, Florida. I've been a podiatrist for 38 years, and I'm making these series of YouTube videos to explain the most common foot conditions to the public. Um, Today we're going to talk about hammer toes. I'm going to start off by telling you what is a hammer toe and what causes it. Uh, and how it causes a lot of pain throughout the foot. I'm going to take my time. I'm going to talk to you the same way I would talk to one of my patients so that you could understand what the real problem is. Now, first off, hammer toes are caused by muscle imbalances in the toe. It is not caused by shoes. Let me repeat that. People say shoes are the cause of most foot problems, and they're not. Shoes will irritate and make worse most foot problems. Again, this is my opinion, and not everyone agrees with me, but I'm just saying that based on treating 20,000 people over 38 years. Again, if you stick your foot into a shoe that you shouldn't be wearing, regardless of the reason, your foot's going to be hurting you. And that's more common sense than anything else. And women do that on a daily basis, and I understand that. But if a woman gets a corn thereafter, it's not because of the shoe, but it's because she has an underlying tendency to have foot problems and form foot problems. And the proof of that is every woman who puts on that same type of shoe doesn't get a corn or a callus or a bunion. Why does that woman? And the reason that woman gets those problems is because she was born with the tendency to have bad feet. That's a whole nother story, but I'm going to talk about, again, to get back to hammer toes. Hammer toes are those mostly on the little toes that look like this and that are abnormally shaped. And they look like, people say they look like hammers. I think personally, if you look at it closely, it looks like a hammer of a piano. If you look under the top of a piano, you see all those hammers, and it looks almost exactly like that. Um, and that's why I personally think that's why they call them hammer toes. Um, First and foremost, hammer toes are caused by muscle imbalances in the toe. They end up the vast majority of the time being bone problems, but they start out as muscle imbalances. And let me tell you, allow me to tell you this, the reason behind that. I'll take a couple of minutes, but I want you to try to understand it. There are various groups of muscles in our feet that do various different things. And the purpose of these muscles are to offset or to keep in balance one set of muscles over the other. Now, if for whatever reason one set of muscles falls down on the job or doesn't do what they're supposed to do, another group of muscles will get an advantage and form deformities. And we see this throughout the foot on an ongoing basis. Again, that's many times the reason for various types of foot problems. Now, specifically in the hammer toe, there's a group of tiny muscles deep inside our foot called intrinsic muscles. And there are two groups of these muscles called the lumbricalis and the intiocheres. I know they're crazy names, but that's what they are. And their job is to stabilize or to balance out other groups of muscles, and the ones that we're interested in is on the toe. Now on the toe you have two muscles that are very important. The top one is called the extensor. It's up on the top, and the bottom one is called the flexor. Now, if those muscles are not kept in check, a reaction will occur where the toe is pulled back, causing the hammering of the toe to occur. Getting back to the interossei and the lumbricalis, if your foot does not work right and does abnormal motion, it's called pronation, it's going to affect the lumbricalis and the interossei, or these intrinsic muscles not to work right. And when that occurs, the extensor tendon and the flexor tendon gets a abnormal advantage and will pull back and contract and form the hammer toe. Now, as that goes along, there is a reaction in the bones of the toe that causes you to have a abnormality right at the top. Let me stand up for a second and show you this nice picture of a hammer toe. Now this bone here is called the metatarsal bone. In the hammer toe, that bone abnormally pushes down. And because of that, there's a seesaw effect that then causes this toe, known as the proximal phalanx, to push up. Now when that occurs, the very, very top of the toe will buckle, causing the pain, causing a bony abnormality at the very top of the toe. That is the spot that we most commonly gets corns. When that occurs, that's when we most commonly get a corn, is right at that spot. Let me show you again. Now again, the tendons and the muscles pull back, causing the toe to deform, and this is the hammer toe. Now with time, if it's stuck in that position for a long time, you will get what's known as bone adaptation right here, and you'll get literally arthritis in that part of the toe. So that is the reason that you will get a hammer toe, is that you have a muscle imbalance in your foot caused by the fact that your foot does not work right and throws things out of kilter, causing the toe to contract and hammer like this. Let me show you a diagram from my first book, Why You Really Hurt. And this is the most common locations of corns and soft corns, also caused by hammer toes. Most of the time you will not get a corn unless you have a hammer toe. And that's because unless you have the contracture of that joint, that joint will not stick up and be irritated by a shoe. Yes, a shoe must be present to form a corn to cause irritation. You could have the worst hammer toes in the world, but if you wear nothing but sandals and there's no irritation, then you won't get any corns. Again, it's not the shoe that's causing the corn. It is the hammer toe. Now, treatments. There are many treatments of hammer toes, and we are very fortunate that our government, through the National Guideline Clearinghouse, puts out a series of reports, so to speak, on all major medical conditions. It's called the National Guideline Clearinghouse, and in the description box, I will put the URL to tell you how to get there. They put out a very nice one for hammer toes, and the purpose of that is to tell the physician, is to tell the podiatrist what type of recommendations there are in not only diagnosing the condition, but in treating it. Now, there are many non-surgical treatments, and there's many surgical treatments, depending on how severe you are. If you do have a hammer toe, it does not mean you need surgery. And again, you could try, being a foot doctor, I tell you, of course, go see a foot doctor. But if you want to try non-surgical treatments, I'm not big on medicated corn pads. If you want to get a corn pad to treat the corn associated with your hammer toe, uh, medicated is nothing more than an acid that's going to burn off the skin on top of the toe. It is not going to treat the problem. The problem with a corn is always a hammer toe. Now, a lot of times you could treat this without surgery, but if it reaches the point where surgery is needed, of course you want to go see your podiatrist. It's a very common problem that as foot doctors we treat, and again, we are able, we have a whole series of different types of surgeries to help treat this condition. And many times, all that is needed is to cut those two abnormal tendons, the one on top and the one on bottom, to then bring the toe down again to stop it from buckling and to stop it from hammering. But in order for this to occur, you must have what's called a flexible hammer toe, so you still have movement within that joint that is deformed. If it's reached a point where, in fact, that it is very rigid and it cannot move, that's where bone surgeries are indicated, and there's many different types of bone surgeries. I go into all this in much deeper detail at my website, footcareforyou.com. Again, any way you could spell footcareforyou.com, you will get to my website. And again, in the description box, I will be happy to put that address. That's basically the high points of what I wanted to talk about. I'll tell you what a hammer toe is and how to treat it with and without surgery. But as anything else, you need to get someone who knows what they're doing. Just because a doctor thinks he knows how to do it does not mean he does. You need to ask this man, how many has he done in the past 6 months? How many has he done in the past year? And most important, specifically, exactly what training has he had with foot surgery on the human foot, or what experience does he have on the human foot? Just because he might have done one several years ago does not make him proficient. And as a foot doctor, my major part of my time is repairing poor foot surgeries done by surgeons who never had the proper training to do a foot surgery. So I just encourage you that if you to see your local podiatrist and allow him to help you out. Thanks again for coming down and visiting me, and hopefully I'll see you again soon with another video. Have a nice day. Bye-bye.